Hi, I'm Dr. Alexander Digenis, and I'd like to talk to you for a minute about non-surgical facial rejuvenation and skincare. We offer, in addition to surgeries, a comprehensive overview of patients' skin and an anti-aging program, particularly for the face. And this involves a number of different non-surgical interventions and therapies, such as chemical peels, light therapy, laser therapy, as well as fillers and Botox or Botox-like weakeners of the muscles of the face to try to reduce lines. An overview of this philosophy is that basically skincare is the basis for good prevention for aging in the face. And so we have a team of estheticians and skincare specialists who can advise the patient regarding a program that can improve what they currently do, as well as add or subtract things that will give them a better long-term plan in terms of improving their skin. And the basic philosophy of skincare is to try to get the skin to rejuvenate itself. The skin is a marvelous organ. Unlike what most people think, as you take off the top layers of the skin in a controlled fashion, the skin rejuvenates itself and lays down new layers of collagen as well as younger cells. And so usually this involves not only a process of cleansing the skin, but also either mechanically exfoliating the skin, which is often called microdermabrasion, as well as more intense therapies, which can go a little bit deeper using chemical peels, and finally the ultimate, which is laser. Most of the lasers we do usually involve CO2 fractional lasers, and these are an improvement from previous laser therapies in that they can be done in the office. They go a little deeper than the peels. The downtime, of course, is a little bit longer, but in general we can take care of more irregularities, wrinkles, and changes in the skin due to age, expression, as well as acne. And so we try to deal with patients' skin and improve their, not only improve their immediate appearance, but long term try to put them on plans that will maintain and enhance their skin. In addition to those core principles in terms of skincare, we also have a variety of non-surgical techniques to try to improve the face, either by filling lines, depressions, and the loss of volume in the face. As we age, not only do we burn lines from our expressiveness, but we also lose volume. And so there's been a whole new host of fillers that can give the face a rejuvenated look by placing fillers either deep or more superficially in the skin. We provide a wide variety of these fillers, including Juvederm, Restylane, Sculptra, and Redis. All of these have different advantages, and we customize a plan to each patient. These fillers are often confused with a more famous type of non-surgical therapy called Botox. Now there are a number of these type of Botox-like agents. The most commonly used other than Botox is also called Dysport, and there are several that are on the market this time. And these are essentially weakeners of the muscle. They don't fill anything, but they actually weaken the muscles of expression that tend to etch lines in our face. These are muscles that are only there for expression. The two most common that we treat are the scowl lines and the forehead lines, as well as the crow's feet around the eyes. And so we place Botox in these areas to reduce the strength of the muscle and therefore the creation of the line. So not only do you look better in the short term, but there's also a preventative aspect in that if you can't wrinkle as much, you're not going to form those lines as quickly. So despite the misconceptions about Botox, it's actually a marvelous preventative therapy. Interestingly, the fillers, which don't weaken anything, but actually fill things, and we tend to use those, we can fill lines in the forehead as well as the parenthesis lines called the nasolabial folds. But these have also been shown to stimulate collagen, and we're seeing longer and longer results for patients. For Botox-like weakeners, they usually last about 3 to 5 months. The average is about 4. Fillers last longer. They can last anywhere between 6 months to a year, and in some cases up to 3 years with repeated injections. So there's a variety of non-surgical things now in the toolbox of the plastic surgeon to help his patients. And again, it needs a customized approach that needs to be done in a professional setting that can give you good advice and build a plan over a long-term review of the patient's skin care. If you have any questions, don't hesitate to call us. Thank you for listening. If you would like more information, don't hesitate to call our telephone number at area code 502-589-5544. Thank you for your attention.